they're coming. They're coming, Andrew. They're coming.
Oh, it's Mutt and Jeff. No, because I want to be able to see that.
Yeah.
Barney,
Thank God, you make me feel tall.
Yeah.
Bernie, Greta, come on. Good afternoon, everyone. I'm Mayor Laura Hoydick. I'm here today with Superintendent of Schools Janet Robinson and Health Director Andrea Busman. And we're here to talk to you today about the Health Director and Superintendent's closing of Wilcoxon School and how we, the town of Stratford, are dealing with the COVID-19 virus. And I'll start with introducing Andrea to you. As you can tell, there's a little bit of a height differential here, and now we will be more on the same page.
And adjusting the microphone. Good afternoon. My name is Andrea Boisvane, and I'm the Director of Health for the town of Stratford. We have been planning for this kind of event for almost 10 years, and it wasn't really a matter of if COVID-19 was arriving in Stratford, it was a matter of when. And we have coalesced a team of incredible partners to work on this. Our emergency management team comprised of EMS, public health, police, fire, our partners at the Board of Ed, of course the mayor's office, and so forth. And we are working together to address this issue. And so when I talk about an issue, it is we have a person in the Wilcoxon School who is suspected of having COVID-19. It has not been confirmed yet, and we are participating. We are working hand in glove with our partners at the State Health Department to do what's called a contact tracing. That is what we do in public health, to be able to determine at what point a person gets ill, and then confirmation of the disease, and then being able to try and figure out how we address those that may have been exposed. And so in the absence of vaccine and antivirals, which we don't have today, our public health approach is to do using what's called non-pharmaceutical interventions, and that is personal approach where there's hand washing and respiratory etiquette, coughing into your elbow, hand hygiene, and voluntary quarantine. Environmental issues is a second approach, and that includes routine cleaning. The third one is community efforts, which includes potentially school closures, social distancing, and things like that. And so with that, I'd like to have Dr. Janet Robinson, our Superintendent of Schools, to talk about the community action that we've taken today.
Thank you. I appreciate that, Andrea. And I want to thank the Stratford Health Department for their guidance and expertise during what is really a very serious situation for us. At their request, as well as for an abundance of caution for our students and staff, that we are announcing the closure of Wilcoxon Elementary School effective tomorrow through Friday of this week. During this period, we are bringing in folks for extensive cleaning and sanitation of that building. Once we were made aware of from our health department that one of our students may have potentially been exposed to the virus, together we took immediate action. Students, parents, and teachers at Wilcoxon have been notified in a letter sent home earlier today. As superintendent, I can tell you that as of right now, no other schools are impacted. Of course, we are seeing this is an ever-changing situation, and we have plans in place in the event that other measures become necessary. We will continue to work closely with our health department, as we all want nothing more than our school community to be as safe as possible. Thank you.
As we spoke about ongoing efforts, I'd like to introduce our Public Safety Director, Larry Ciccarelli, our public nurse, Bernice Bova, and our Assistant Health Director, Greta Brunneal. And this is just part of the team. As you can see when you look around the room, that the other public safety chiefs are here, and we're all very engaged in this and working together. So we will take questions and answer them the best we can. I also want to reiterate, if you do have questions, if you would like to email the mayor's office, That's mayor@townofstratford.com. What will happen is we will then put you on an email list and update you every day as we get new information. It'll either come from the superintendent or Andrea, but at least we'll have one list that we can go through, and then we will develop a website to keep everyone abreast of how we're handling this. So are there any questions?
Yes.
Anna?
You said that, Dr. Robinson, you said that there were plans in place in the event other measures became necessary. Can you offer any specifics as to what those plans would be?
Well, last night, the mayor and first selectman of Connecticut, along with emergency directors and the superintendents, had a conference with the governor and the commissioner of education and other officials. And we talked about if there was a need at some point to close schools for up to 2 weeks, that we would have some type of instruction for students that would be distance learning. So we are trying to be overly prepared in the event we need to do that.
Okay. Anybody else?
Do you guys know where the student might have come in contact or how this was brought to your attention?
I don't know how it was brought to our attention. Do you? Public health?
So we were notified by the state health department, so that's their process. They have a database of contacts and our database in terms of, they've got the the testing.
Do you know when you might be able to confirm whether the student has coronavirus or not?
So that's a good question. So they've been tested, and we're not exactly sure. We're hoping by tomorrow, but it's an ongoing investigation. As you know, there are plenty of people who are in the queue to be tested.
Say how old the student is or whether they're a boy or a girl or what specific?
Right now we're just it's still suspect, and we don't want to go into those details yet.
Did you say the student has no symptoms or are they exhibiting?
The student is under care of a healthcare provider, so I don't have I'm not willing to share that just yet.
So just to clarify, you mentioned that distance learning will be an option if this were to continue or progress. Can you clarify?
Yes, last night in our conference call, the commissioner laid out a process where we would need to submit for a waiver with the state for the required 180 days. We would like any days that we're out of school and we're doing distance learning with the students, we would like those days to count toward the 180. So it is our intention, if things move in that direction, that Stratford would apply for that waiver and students would be in contact with their teachers daily through distance learning.
What would qualify to move in the direction? You're only closing one school at this moment. Would it have to be the whole district to close for you to move toward distance learning?
No, if any one school has to close for a period of time, that school, the students will still be in contact with their teachers and receive learning throughout.
If it is found that the student has coronavirus, how many people would have to potentially self-quarantine for 14 days? That's what we're hearing.
So it is an ongoing process, but when someone is positive, typically you have any contacts that are in direct contact that are in quarantine for 14 days. It's something that is evolving, and we're going to need to sort of assess that. And we're really sort of waiting. We need that data to be able to make that next strategic move.
The other thing, Anna, to keep in mind is as other communities are going through this, other emergency management directors like Larry mentioned to me that they're going to be sharing information about our approaches, what's successful, what's not, so we learn as we're going along. But there are other school districts that have closed, the entire school district, so we'll see what their outcomes have been and what their success rate has been. Okay. Well, thank you all, and stay tuned. We'll be in touch. Can't shake